Well, hello everyone. My name is Marty Guthmiller. I'm the CEO at Orange City Area Health System, and we're coming to you with today's daily briefing, which yesterday I indicated may be periodic briefing, but nonetheless, we're here today to share the latest information that we can on COVID-19 and how that's affecting our health system and our local area. The first thing that I'd like to do today is give you the scoreboard that we have. And as of today, we have performed 43 tests at Orange City Area Health System. 3 of those 43 were positive, 34 were negative, and as of this moment, 6 are pending. And we will have those results today, and we will report to you tomorrow with that information as well. I want to start out today by talking about a study that's out there or a source that's out there that you may want to use to follow on your own on COVID-19 projections. This is a site that's referred to as IHME, or Institute for Health Metrics and Evaluation. This is a site that is, I believe, sponsored by the University of Washington and partially funded or completely funded by Bill Gates. So again, IHME, and you can follow along with that as you would like to on the internet yourself. What I'm going to talk about and what IHME projects at this point assumes, and this is a critical assumption, that full social distancing continues through May of 2020. So with these assumptions, with this assumption of social distancing, here are their projections. It's 20 days until we reach peak in Iowa. April 26, 2020 is the current projection for COVID-19 outbreak to peak in Iowa, assuming that we all stay very vigilant with social distancing. Assuming that is the case, there'll be 726 beds that are needed in Iowa. We have 4,297 beds available for a deficit of 0, meaning that we have all the beds we need given the projections for peaking in about 20 days. The number of ICU beds predicted to be in need are 150. The current availability of ICU beds in Iowa is 246, again for a deficit of 0. So in terms of our healthcare capacity in Iowa, and according to the IHME projection, we're in pretty good shape, and that news truly is encouraging. But it requires vigilance over the next several weeks yet with social distancing, washing hands, keeping 6 feet away, that type of thing that you've heard a lot about already. So very good news, but we're not quite out of the woods just yet. I have with me this morning Jeanne Jungers, who's another one of our superstars in our organization. Jeanne has been here almost as long as I have. We'll just say in excess of 20 years at this point. Jeanne has served us extremely well over a couple decades and currently serves as our Director of Quality and Infection Control. Jeanne's going to talk particularly a little bit today about the wearing of masks. And we have some changes coming up. Some are being implemented today. Some will be implemented in the next few days, perhaps. And there's just lots of questions that we have regarding the use of masks. One of the things that I want to talk about first, though, is that you may, if you come to the health system for care of any kind or wherever, you may have a professional who's wearing a mask. What we want to make sure we communicate with this is that professional is not sick. That professional is being protected, and certainly does not want to infect anyone else, of course, but that person is not sick. All right, so we just want to make sure. And also, patients are asymptomatic from time to time, meaning that they're not sick. And so for everyone's benefit, when you're within that 6 feet magic zone, you may have a health professional that wears a mask. And again, it's for your protection, it's for their protection, and don't be too freaked out by that if that happens. We won't be freaked out if you wear one, okay? And so we're going to talk about that a little bit more as we go along. I'd like Jeanne particularly to talk about the mask wearing situation that we implemented this morning at Prairie Ridge and Landsmere Ridge. So Jeanne, could you give us a rundown of what we're doing today in senior care?
I'd be happy to. Out in our senior care campuses, both at Landsmere and Prairie Ridge, effective today, our staff will be wearing masks when they're in the facility and when they're interacting with the residents and tenants there. It's really an effort to, like Marty said, protect those that live there. They're some of our most vulnerable population, the elderly. We want to prevent that spread of the virus as our knowledge grows about the COVID the virus. There's been some evidence that sometimes pre-symptomatic, so people that are, just ready to get sick or don't have the symptoms yet can spread that virus. And so we want to protect our staff and we want to protect our residents and tenants at Landsmere. And so that's why we've instituted that out there. We're going to do what we can to still have those personal interactions and not cause alarm for those that live there, and have gone around and explained that this new change in what we're doing out there. And so hope that everybody will understand that that's a way that we can protect some of our most vulnerable people.
Thanks, Jeanne. And to that point, we're very cognizant of the psychological impact that this is all having, that social distancing is having on our senior population. It's beginning to have an impact. People are sadder. And now when we have people taking care of them who have masks on, is that going to have a further detrimental impact? And so we're very aware of that. We think the risks outweigh the benefit. It's a risk-benefit, a cost-benefit sort of situation. And we're doing everything we can to try to address the psychological and social impact of all of this. And another thing that came to mind was we have good supply still. We're very grateful for the number of sewn masks that have been done in our community. In fact, those are going to be implemented largely in our senior care environment because they have a softer impact. They'll be lined with the surgical mask so that it's every bit as protective, but it just gives a softer feel to everything. So we're very grateful for those of you that have donated those masks. We have several hundred, I believe. And if you want to continue to make the masks, there are a couple different kinds. I think
Marty's going to demo one right here.
I won't be able to put it over. Okay, so this is the mask that was first sent out there. It's a little more complicated to make than the pleated mask.
Right.
There are instructions on our website that we've received from other entities to do that. And these masks have a lining that our professional workers will be using that's replaceable. So this can be washed every day. The insert inside this will be replaced every 5 days.
Right. Right.
And we'll be good to go. So these have proven to be very valuable. And the pleated masks are also good, and we'll use those appropriately. The thing that you have to be careful with masks also is that they don't give you an overconfident sort of thing. You have to be very careful on touching your face and your eye and all that. So you are not bulletproof
Right.
just
Right.
because you wear a
Right.
mask. And so you have to be careful with that as well. And if you can't keep your hands off your face and eyes, then maybe you're better off not wearing a mask.
Right. Right. And just doing the social distancing.
Right. Social distancing is still by far
Mm-hmm.
the most important thing. Jeannie, we're going to shift a little bit now to the environment within our healthcare facilities themselves. I mean, sometimes people are, first of all, our employees.
Mm-hmm.
Is this a safe place to be? Which of course is really important to us. But then also for patients coming in.
Mm-hmm.
And could you talk about what our position is relative to that?
Sure. Sure. We are doing everything we can to make sure that this environment here is safe, clean. We are restricting any visitors and extra people that are coming into our facility. We're screening all employees as they come in, doing asking for respiratory symptoms, temperatures, that sort of thing. We've stepped up our hand washing, our hand hygiene, multiple dispensers everywhere you look, so that, and people are more, everywhere I go in the hospital, as I walk down the hall, I see people washing their hands. And so we feel like this is a safe place to both work and come if you need to, if you need medical care. This is about as safe as it can get. So.
Good. And another thing that we're doing, again, yesterday I mentioned the fluidity of the whole situation. And this literally does change by the hour. But as an example, I believe this afternoon is scheduled training on the UV light system.
Yes.
We ordered a very high-end ultraviolet light disinfecting system that will be, well, I think it arrived yesterday. We'll be trained, our staff will be trained on it this afternoon, and we'll probably begin implementing this right away. This is a system that we can clean an entire room in 5 to 10 minutes. We can clean an OR. We can take care of a patient room. We can take care of a lot of different areas with this ultraviolet light, and it's really a slick system, a very clean system, a technical system, and we'll begin training on that this afternoon. Again, creating an environment here that's as safe as we can predict.
And our priority for that use of that UV light initially is to use it in rooms where we've had a person who's either suspected of having COVID or symptoms of COVID or that sort of thing, to be able to turn those rooms over and ensure that they're as clean as possible before the next person uses that room.
Yeah, and so, okay, so we talked a little bit about this environment. Jeannie, can you talk a little bit about if somebody wants to wear a mask coming into this facility, and talk about a couple of the questions that we've gotten on that list as well.
Okay. We've been asked, should people who are coming into the facility for non-respiratory or non-illness kinds of things wear a mask? And that really is a personal decision. If you would like to wear a mask, that's absolutely fine. The simple pleated cloth masks are just fine. Like Marty said, though, we don't want you to assume that the mask gives you a false sense of security. So you want to wash your hands before you put the mask on. You want to be careful not to touch the front of the mask when you put it on, and then avoid constantly touching the front of the mask to adjust it. And if you do that, try to wash your hands after doing that. But if you would like to wear a mask, it's perfectly fine. It doesn't take away the need for social distancing, the 6 feet away from other people, or the need for hand hygiene. So just want to make sure that that's clear. The other times when masks are not appropriate is for a child under the age of 2. So if you have a child under 2, they should not have that cloth mask on. Or if you are someone who has trouble breathing, or if you're someone in your household is not able to take the mask off themselves, you would not want to put a mask on them. So those would be the times when a mask would not really be the right thing to do.
Good. Okay, thanks, Jeannie. Appreciate that. maybe we'll finish up with our, finish up this particular topic with our walk-in clinic is still open at this time and available. Again, it's important to understand the disinfection that we're doing, the hygiene that we're practicing, and it is as safe as it can be during this time. And so we want to offer that. We want to remind people that our well clinic is also open and ready to go. It's not, again, there's no place that's 100% safe, but it's as safe as it can be at this point. And then our acute clinic is also still there and ready to serve you. So it's important for you to understand that there are a number of great practices being practiced right now here regarding the cleanliness and sterileness of our facility to the extent that it can be. And we just wanted to make that clear. I'd like to end today by talking about a lot of pressure that our governor has been on, including from the Iowa Hospital Association, quite frankly, to shelter in place, to order the sheltering in place. And I thought I would address, because there's some people throughout the state and occasionally on our social media platform that say, why isn't Governor Reynolds doing more? Why isn't she just shutting everything down? And yesterday there was a conversation apparently between Dr. Anthony Fauci, who's the director of National Institute of Allergy and Infectious Diseases, and you've probably seen him very prominently with President Trump and others on TV, and he's one of the best experts in the country. And in fact, these remarks that I'm going to say here come from the White House briefing on Monday, April 6th. And this deals directly with Iowa and Nebraska. And I will quote Dr. Fauci now. I had good conversations with the governor of Nebraska and the governor of Iowa here. And it's interesting that functionally, even though they have not given a strict stay at home, what they are doing is really functionally equivalent to that, Fauci said. I think there was a public response that they weren't really doing anything at all, and they really are doing a very good job, both of them. Those are the only two that I spoke to, but it was a really good conversation. I want to make sure people understand that just because they don't have a very strict stay-at-home order, they have in place a lot of things that are totally compatible with what everyone else is doing, end quote. So what Dr. Fauci is saying is what we're practicing in Iowa is effectively sheltering in place. And that by and large, people are complying, and it is having a huge impact on the way that we are able to keep the level down of infection at this point. And certainly the numbers I gave you earlier from IHME indicate that if we continue to be vigilant for the next few weeks, we're going to stay well below the curve. Our numbers are going to be significantly lower than expected, and we just need to stay the course. And so again, on behalf of all of us at Orange City Area Health System, we implore you to continue practicing those social distancing measures and stay safe out there. Thank you very much for joining us today.